Buenos días.
Good morning and welcome to the 5th Forum Against Cancer Towards a Comprehensive Approach. On behalf of the Spanish Association Against Cancer, we would like to extend our gratitude for being here today. Also at Fundación Telefónica for giving us this space and for the aid in the organization of this forum. This year, the topic we will be reflecting upon is going with the people with cancer, the value of voluntary work for quality assistance. We would like to start by inviting the Queen, Her Majesty the Queen Letizia, to say a few words. She is the President of Honor of the Spanish Association Against Cancer.
Vale. Muy buenos días.
Good morning. Welcome to this 5th forum organized by the Spanish Association Against Cancer at this wonderful auditorium of Fundación Telefónica. Thank you, César, for being such a great host and for being so involved in the issues. As most of you know, this Forum Against Cancer aims to analyze every year in an isolated manner the different topics that are related with the activities of the Spanish Association Against Cancer, which is, in short, about helping people living with cancer and their families to have a better quality of life. Every year we cover different specific topics. This is the 5th year, and now, in this current edition, we will be analyzing, together with all of you working in the area, that comprehensive approach that the Spanish Association aims to tackle cancer. We will talk, therefore, about voluntary workers, the value of voluntary work, what it is about to provide help and support to those who need it most. Being a voluntary worker is important in its own right, but that decision needs to be part of an organized system, a well-balanced system, and also a system that is well ordered so that it can be of great help. So we will be starting straight away. Thank you. Thank you, Majesty. We will now give the floor to Mr. Alfonso Alonso. He is the Spanish Minister of Health, Social Affairs and Equality. Thank you, Her Majesty, dear Isabel, the President of the Spanish Association Against Cancer, the Secretary of State, César. Thank you for being such a great host, and I will try to be as brief as the Queen, but this is always hard. It is true that we are all eager to listen to the discussions here. I remember that last year we covered palliative care, and now I am actually about to leave office, but we did have time to do many things in 2015. We have come a long way. We carry on working, and just to show the work and the involvement from the government of Spain, we can actually mention the 400 million euros that we actually provided for research and the approval of more than 300 clinical trials, and this has allowed us to incorporate new and innovative drugs for oncological use in the last few years. We will be talking about voluntary work today, about what this association does, how it coordinates the activities, and how they can actually organize all the different players, from the administrations to the professionals in healthcare, to doctors, in the areas of support to the families and to the people living with cancer, to the people who actually do beat this disease, and who I would like to mention specifically. I think it is paramount to have a vision in Spain from the Spanish society to understand that solidarity is among the people, and in order to help people, we have those that devote their time in caring for others. This is really important, and I'm saying this because we do have support programs to these initiatives through different associations, and we do have a series of means in order to reduce the income tax for these activities, and this actually helps the voluntary activities going forward. And I believe that having a national program based on solidarity and actually based and focused on the capacity we have to give to the community, I think is really important. And in the passioning future we have ahead of us, I do hope that we will be able to continue to support these initiatives, and by taking the example led by all of you. Thank you. Thank you. And just to show you the international backing that we have, this International Forum Against Cancer, we have the words from Dr. Tezer Kutluk. He is the president of the International Union Against Cancer.
World Cancer Day is a truly global event taking place every year on 4th of February to unite the world's population in the fight against cancer. It aims to save millions of preventable deaths each year by raising awareness and education about the disease, pressing governments and individuals across the world to take action. Taking place under the tagline, "We Can, I Can," this World Cancer Day campaign is about exploring how everyone, together or individually, can do their part to reduce the global burden of cancer. A message which I know that the Spanish Association Against Cancer drives forward passionately. UICC applauds your efforts as a leading organization amongst our membership, and particularly in Spain, as you work so diligently with civil society to decrease the cancer burden through cancer prevention awareness, investing on cancer research, and improving cancer care and outcomes for cancer patients. It is fantastic to learn that your forum this week, you are highlighting the role of volunteers in this case and support cancer patients and their families. I thank you very much to Spanish Association Against Cancer and everybody for their great support for World Cancer Day. I wish you all a successful campaign.
We will now give the floor to Dr. Maria Luisa Becina. She is a professor at the Psychology and Science faculty, and she will talk about support to cancer patients in today's society. Thank you for your introduction and for your invitation. Of course, it gives me great pleasure to be here with all of you to share this issue, which I have been researching for a number of years, and where actually becomes more interesting and useful is at this type of fora where we have some action involved, not just research perspectives. Without further ado, we will commence with the aim of this forum. We will start with a question that might sound very roundabout. Is it possible to organize, to integrate the organized activities of voluntary entities in the current health structure? I do hope that at this debate we will be able to figure out the answer to this question. The aim of this presentation is to provide empirical evidence for and against this point. And the first evidence that we have is that there are no empirical studies that show any negative effects from the assistance to patients with cancer. And this comes from a recent study. It is a meta-study that includes other studies with very rigorous methods, and it actually goes or spans over a longer time from 1990 to 2013. It includes both quantitative and qualitative methods, and it is based in North America, but there are also some studies that were carried out in Europe. We might be led to think that this evidence is just at a current point in time, and we might be skeptical about it, but I must say that we doctors have to be very careful about these issues, and if we have failed to describe these areas, is because we didn't find any evidence. So we might actually ask ourselves certain other questions. Why are we faced with this challenge today? And, well, we have been able to make some former deadly diseases, we have convert them into chronic diseases, and we can go beyond the different needs and different areas, the needs of the people. We also can argue about the different experiences and data that could support good incorporation of voluntary work in healthcare. It would be a matter of agreeing on whether this should be done or not. And once we have this agreement, we might be in a position to think about how we should go about it. This is all open to debate, and we can have different forms and means to do so. With regard to the second question, and that's the aim of this presentation, why is it worth integrating the activities of voluntary entities within the actual healthcare structures? We could actually provide many arguments and many evidence. Nobody would actually argue the World Health Organization guidelines as the status, total state of well-being, both at physical, at the psychological, and at the social levels. And it is true that we can actually observe different rhythms to attain these dimensions. So we have the physical aspect in the first case, and only recently we have incorporated psychological attention, different specialities, but not in all spheres. For example, in general practice, we don't have any access to psychology aid, and in other areas we are not actually on the level that we should be reaching. Then we have the social sphere. And to be realistic, we still have a long way to go, and nothing has been done here. Other arguments we might actually add, well, many empirical studies actually do show the interrelation between the different social and psychological and physical factors. It is clear that physical factors do have an impact, both at the psychological and at the social level. We can actually think about infectious diseases or diseases that actually have an effect on your physical condition. You also have different psychological factors that can actually have an influence on the evolution of the physical conditions, and this we can actually have the effect of stress, and we are starting to gather more and more evidence that the social conditions actually do determine physical and psychological states. One can argue that the best help, the best mean could be fighting poverty. People living in poverty actually do fall ill with things that do not affect people who do not have this condition of poverty. We can also appeal to our own intuition in order to evidence this interrelation between physical, psychological and social factors, and I would like to ask you to answer this question. Would you rather live a short, happy life or a long, unhappy life? Well, first of all, the difficulty in answering this question actually does show the interrelation between the physical, psychological and social factors, because deep down what people feel that should come together, we are not in a position to separate it. And I'm sure some of you would have chosen to live a short life but a happy life, and this actually does support our own experience. Within voluntary work, we can argue that voluntary work is actually based on or inspired by human values, based on equality, freedom, solidarity, justice, participation and social cohesion. This is truly human society, a society that can be actually called a human society, should actually be based on these values, and voluntary work actually does represent this very well. Also, voluntary work is regulated in order to avoid conflicts with professionals and to regulate the quality of their actions. We have the Act of Voluntary Work. This would be an example. It has been regulated for over 2 decades in this country, and voluntary activities should be complementary to those activities provided by the professionals. They actually are part of an organizational context. They should be related to specific aims. Also, voluntary work has shown to have numerous positive effects for all peoples involved, both on the actors and on the receivers and also on the observers. We will now be going over these positive effects for the actual voluntary workers. Voluntary work actually resulted are very beneficial activities because they do feel they feel happier and more satisfied about their lives. It also has an impact on the psychological sphere. They feel that their life have a meaning and that they can control their surrounding and their life. Also, at the physical level, voluntary workers do not fall ill as often, and when they do, they recover more quickly. Voluntary workers, there are some studies that actually argue that they live longer and they lead a better life. As far as the action mechanisms that could be behind this are many. The voluntary activity should come out of the will and not of an action that must be fulfilled. They actually require the participation, the active participation from the people, and they actually need different values in order to fight social injustice. And this is just to name a few out of the more than 200 that the author Seligman actually recorded. And voluntary work would actually be beneficial for the people who provide these activities, but there are also positive effects that have been described on the actual people receiving that voluntary support. They have described subjective satisfaction, psychological well-being, sociability. They reduce their symptoms, and they also have greater life expectancy. Just to give you an example from a specific study, they actually did say that patients in hospital that received visits from voluntary workers who had training in specific things, talking and attending to the personal care needs, they actually lived an average of 80 days longer than those patients who did not receive such voluntary assistance. We might think that this is not a lot, but we can actually put it as 3 times as more. Also, the family members are benefiting from these activities, as they actually can be let off for up to 3.3 hours. The action mechanisms that can be behind of these positive effects are those related to social support. Empirical lines show that social support, both at the material, at the informational and the emotional levels, has an important effect, a direct effect and also indirect effect on health. These are direct effects because social support avoids a great deal of stress. So having a sound social support network, we will be avoiding many bad things that could happen to us otherwise. But we also have some indirect effects. The people who have a good support social network will suffer a lesser extent of negative effects, just due to the fact that they do have their support. And we could also argue the positive effects on observers, on the people who are around these social activities and who are actually, we can describe in terms of elevation. Elevation is a moral attitude that is based on reciprocity. They actually generate a series of aid or assistance connections that incentivize these policies. and there are other actions that do avoid, for example, revenge, but elevation would actually empower this type of assistance, and this is a moral emotion, and this comes about when we actually witness actions that reflect the best in human beings. It is felt as a feeling of affection on your chest, and actually gives you the will to be better people, to share, to cooperate, to help, and to participate. Thanks to some advertising, we can actually experiment this emotion in just a few seconds. I'm not sure if you're ready for this. Okay. We'll just need to play this video. Well, have we been elevated? I'm sure we all liked seeing that we live in a world where people do help each other, and we actually want to be better people ourselves. So this is emotion. This is the elevation emotion I was talking about before. It's about helping each other. The action mechanisms behind this emotion could actually be the actors. For the actors, they actually experiment pride and satisfaction for what they did. Receivers actually do experiment a feeling of gratitude, and spectators or observers actually experiment elevation, which makes it more likely for them to want to be actors. And I believe that we all prefer to live in a society where people want to aim to be better, rather than at a self-centered society or an egocentric society. Just to conclude, we can argue that conducts involved in voluntary work are perfectly delimited, and they actually are based on quality criteria. They also cover important needs that all people have at the social level. They benefit those who provide them, they benefit both who receive them, and they benefit the society as a whole. Furthermore, this prize, these consequences, these positive consequences, do not cost a penny. There are some studies that actually argue that they save money, but the basics is that it doesn't cost anything. So this would be the reason behind going for this voluntary work. And now we will talk about how we can integrate voluntary work within the current health system. There are many formulas, many possible formulas that could actually be developed, and at the end of the day we can actually say that it is very positive to try to provide those people who are vulnerable due to their illnesses the social support that any human developed and well-articulated society can and should provide. And I will now leave you with another unique quality of human beings, and that is creativity. I will let you continue with the debate, with the discussions, and move to action. Thank you.
Muchas gracias, doctora Vecina.
Thank you, Dr. Vecina, for your framework presentation. I will now start the second part of this forum. We'll now to call on stage Mrs. Mamen Mendizabal. Good morning, everyone. It is the time for debate, and I will now present the two debates we will have coming up in order to go further in the issues that we have heard about already. We will talk about going with the people. We will also talk about this feeling of loneliness, the public versus the private, and the two issues will be, the first of all is whether voluntary work should be one more area of the assistance, and second, the actual value of voluntary works. We will hear from specific experiences from the UK, some initiatives from Extremadura here in Spain, and I would not like to take too much time. I would like to call on stage Dr. Jesús García Pontillas and María Eugenia Olivares. They are both doctors. María Eugenia Olivares is a psychologist from San Carlos Clinical Hospital in Madrid. She has great experience in psychological intervention with cancer patients. You can take a seat. And Dr. Jesús García is an oncologist from the Fundación Jiménez Díaz Hospital in Madrid. He also has a vast experience both in research and in treatment to patients living with cancer. We will start the first debate with them, and I would like to ask you to what extent we can actually see voluntary assistance and to what extent it actually is part of the healthcare system. And we will be focusing on three different areas. We will have certain participation from the people, also from the social networks, and we want to focus on entertainment, accompanying information and instrumental support. You have the floor.
As for your question concerning the debate, is it needs to be a member of the health team, we need to analyze that if we have this kind of team where we take decisions concerning diagnosis and therapeutical applications, of course the answer would be yes. If we need to apply this in a larger way and we understand this team as the subject that is going to cover a lot of needs of the patient, of course the answer would be again yes. This approach is a very studied one, and we concluded that this is a process that will affect everybody, so we need to question the way this, as the previous speaker said, how do we need to integrate this process in order to have the patient as the major beneficiary of it. I would like to start by emphasizing something that is quite important, is intrinsic value of voluntary work. It is important because the main issue here is the way all the specialist team treating the patient are turning around the patient, and that we have developed this personal model of medicine, and this has become a teamwork approach. And we need to think about this, taking into consideration which is the function and the tasks of each one of the members integrated in voluntary work, because the voluntary worker needs to approach it in a comprehensive way, and the oncological care, cancer care, needs to be analyzed this way. So which is the role of the voluntary? If when it comes to the families, to the relatives, to the patient, with all the elements, I would say two things. First of all, voluntarism needs to be approached in all the stages of the disease. First, diagnosis until the last stages. We need to tackle all the process from the consultation, visiting the hospital, radiotherapy, and even taking into consideration all the areas intervening the treatment as the psychological areas and the rest of the team. There is a place for a voluntary there, and in this large, broad context, I would like to, as I said before to María Eugenia Mamen, the first point here is, and the very important one, is accompanying. This means on one hand the patient, because this patient is alone a very important, quite a broad time, and then we need to approach it in an intelligent way so that the voluntary worker would accompany the patient and at the same time listen to the patient, discover vulnerabilities and needs, And in that sense, we have an important work to be done. The other point is caregivers or providers. These actors need a break. I mean, relatives need to take a break from this care providing. And there is a point where the voluntary worker would allow the family to take this distance from the problem. I don't know if I am clear. As I've been commenting with Jesus, when we talk about accompanying, we need to be careful about this point, because maybe we are taking or we are given the voluntary work tasks he's not prepared for, trained for, and we need to be careful, because both on the side of the patient and for the side of the voluntary worker, I mean, there is an emotional commitment, and we have examples of voluntary workers that are visiting funeral after funeral, and they are at the end quite touched. We should also nuance that we are getting into the personal space of the patient and the family, and sometimes they are even working at the house, at the home of the patient, and the moment of diagnosis is not equal to the palliative stage of the disease. So there is a different approach to be taken, because maybe the patient needs more privacy at that stage. So there are different circumstances and issues of the patient that we are living with that are not, let's say, easy to take, to handle, smells, images, and you have to protect the voluntary worker of this. And there is another question coming from the social network, and it's important. Caballeros is saying, I don't want to anguish my family. I prefer to live off with the voluntary worker. Is it valid? Of course. It was a release to, there's a patient saying, it was a release to see that the voluntary worker arrived at home. And because sometimes we have to spend so much time with the person next to you, and there is a new person, I mean, introducing new factors. And there's a key factor, because the waiting times in cancer care system or the treatment, it doesn't matter if it is in the hospital or in when you are hospitalized or not. And all the process of the disease sometimes doesn't end as we all wish or want in a healing, but unfortunately it ends in the worst way. It's true that in these cases the work of the voluntary worker is a key factor. So we need to change this concept here. The waiting period until death is less heavy, is less a burden when you have the help of these social workers or the voluntary worker. We're not only thinking about the patient entering this hospital or specialized center, but we need to go a step forward here. In this sense, the social worker will also entertain the patient. And we organize workshops, for example, with these social workers, including music, dancing, several activities that allow changing the whole concept and the whole sense of the life of the patient in that period. And this is another important task that is quite helpful. Obviously, waiting period are each time longer, and so any distraction is quite valued. So we need to have a large broad game of activities, because we need to tackle the differences of interests of the patients, and we need to provide an answer, a response to the interests, to these interests. I have another comment. Not all the patients need our help. We need to be able to identify what do they want. If you arrive there with all your intention and goodwill as a voluntary worker, but you are approaching it in a wrong way, this is not positive. And that's what we were saying before. We are entering a very private space. Last point in the debate, information and support. We don't realize that when there is a patient receiving cancer care treatment, there are a lot of things happening around and defining the environment, and a lot of the times it is quite difficult to tackle because the patient is not in the best moment or in the best shape, either physical or emotional. And it's true that accompanying, informing the patient, going with him, escorting him through the hospital is quite important, because we need to do this task and provide the information of the ways we can support this patient. We have to dispose of the capacities in order to provide an answer from this point of view. And there is a field, the support is critical, because it's going to help not only the patient but also the familial family environment. And if we take into consideration, of course, the respect of the privacy and offering, of course, without invading the patient territory, there is a key role that is well defined and that has a sense and is one of the major points of voluntary work. I will apport a certain nuance to this. Of course, it's about information concerning that the patient and the relatives will dispose of all the information of our resources, our entities, governmental or non-governmental organizations, that the patient and the family would have this information in a very fast, easy way. But then we have to handle this with care. On the one hand, the information that the voluntary worker has about the patient, we have to guarantee that there is a secrecy and a confidentiality in this information handle. Sometimes they are dealing with a great deal of information, and we have to guarantee to ensure that the voluntary worker will respect it. And then on the other hand, we have the other side of the coin, the information provided by the patient. Sometimes I've been a patient and I'll share my experience with you that are now a patient yourself. So as you all know, information is flowing without any control nowadays. Any patient can go into the internet and find loads of information about the disease. But at a certain point, this is mandatory. I mean, providing the information is mandatory, and the information flowing between the patient and the voluntary should be controlled and standardized. I would give the floor to children. I mean, I want the participation of children in this debate. I don't know if Carmen Menendez is there, because she's the president of the Organization for Childhood. Good morning. Thank you very much. First of all, Isabel Oriol, for inviting us to this 5th forum, and congratulations for treating this very important theme here this morning. I would say that in the case of my federation, volunteering is a major point. We have 28 associations of parents distributed through the different autonomous communities, and the guidelines are composed by no, the directive boards are composed by relatives that are working without any remuneration. They are all voluntary workers. And I always say this is the core of our federation. We have this in all the organizations because we have solidary people that are committed with our collective, and the specific voluntarism working in hospitals. We have two teams: those who care about parents, those who deal with those who had a sick child that has already healed, and they provide this psychological support, and those who work with those who are facing or going through the harder part of the disease process. It's true that we face problems in these talks that are after submitted to the professionals of the association. The other group is the group that works with children, people that are young, from between 20 to 30 years old. They deliver workshops in the hospitals because, as you all know, the pediatric cancer care facilities are schools as well. And then in the afternoon they conduct these workshops to provide happiness to these children that are capable of forgetting that they are sick, that they are carrying or supporting or enduring these terrible treatments. And they get this assistance and spend long hours with them. Lastly, I want to comment on the last place where voluntary workers are going right now, and it's UC, intensive care units. It's a great achievement because not even parents were allowed in these units, but now they are accepting the presence of our voluntary workers. And we have also voluntary workers. I had the comment of a colleague that was there. You even he was saying if you could see a child playing with a PlayStation, imagining that he had a PlayStation. These are miracles that only voluntary workers can achieve. It's obvious that this is a personal experience, and it's lovable, and it's the reality day to day. It's more or less what we were talking about before, this accompanying, this emotional release, and of course this is quite touching. As a conclusion, I would like to nuance that obviously, as we said at the beginning, we've reached this seniority. We are not any longer arguing against voluntarism, but we need to discover support variations. We are facing the huge differences among the communities of the social care, healthcare system, and we need to develop differences as well. We need to provide different kind of help, considering the institutions, hospitals, daycare entities, etc. Not all the organizations are supposed to work, are meant to work in the same way, because they are not equal. They are not the same. Heterogeneity. As for the voluntary workers, when it comes to age, motivation of the worker, why do they take this path, and the versatility of the patient. So all these are challenges we need to face. And I would like to finish with 3 words: very good selection, very good training, a very good follow-up. If we have this under control, voluntary work will be one of excellency. Thank you very much. And I would add that we are working in a different model of society. We've changed a lot during the last few years, and it means that from the basic point of research and all the symptoms care should be integrated and comprehensive. And in the same way, it's true that not only any surgeon can go and operate on and intervene, because we need a very wide specialization. It is also true that in this team that we have not only practitioners but biologists, pharmaceutists, we need to integrate a voluntary worker that will have certain standard criteria adapted to the new role that he or her is going to play. I would say that we have to face what I would call the precision voluntarism, and which is this? Is the one that is able to listen and detect vulnerabilities, needs, and at this point of detection, he would be able to provide this information to the person intent to give a solution to a problem, so that we will be intelligently integrated with all the actors and working together in a very coordinative way, and where everyone knows what to do. And this is something that can be detected, discovered by the voluntary work, so that the person that is intended to provide the response will be informed and able to act. So I insist on the teamwork of this. The voluntary worker has a major role. I think it's quite interesting, and I would like to share with you all the impact from the social network. I will share some experiences with you about the integration of voluntary work, and now I am going to give the floor to 3 women. I'm going to invite Melanie Merrill, Maria Jose Redondo, and Paloma Barba. Paloma Barba belongs to the Spanish Association Against Cancer. She coordinates the voluntary work at the Hospital Severo Ochoa in Leganés. She will share with us the experiences she's having at the hospital to accompany cancer patients and their relatives. And Maria Jose Redondo belongs to the healthcare system of Extremadura, which is an autonomous community that is being pioneer and the only one so far in defining a palliative care system. And she's going to talk about that. And from the United Kingdom, we have Melanie Merrill, belonging to the Macmillan Cancer Support, and she will share with us all the work she's been doing with the voluntary network in there, looking to get closer to the patient and the relatives. I'll introduce now Melanie. Melanie, it's your turn.
Good morning, everybody. It's a pleasure to be here today, and I'm really looking forward to sharing with you some of the work that Macmillan Cancer Support, which is one of the leading cancer charities in the UK, are doing in terms of delivering cancer services through our volunteers. Just to give you a very brief introduction to Macmillan. Macmillan was a charity which was set up over 100 years ago by a volunteer. And volunteers continue to remain at the very heart of everything we do at Macmillan. And as you all know, more and more people are living longer beyond cancer, which is really good news, but it does mean that we are having to think about the support services that we are providing to these people and their families. So in 2011, Macmillan decided to develop a very kind of bold strategy and ambition, which is to reach and improve the lives of everyone living with cancer and to inspire millions of others to do the same. We recognise that with the rates of cancer increasing and the life expectancy, people living longer, that the services and the support that we were providing wasn't just not going to be enough to meet the needs of people in 20 years' time. So one of the solutions is to inspire more and more people to give their time through volunteering. So my role within Macmillan is I'm a volunteering programme manager, and my role is to help develop and consider some of the services that we are developing to involve volunteers. At Macmillan we have around, and I say this loosely because there are a lot more, we have around 20,000 volunteers providing a wide range of activities for Macmillan. Some of our volunteers raise money and awareness, obviously to help us deliver and fund some of the services that we provide. We deliver a whole range of services in the community, providing advice and guidance and support to befriending and companionship. We also work very, very closely with a lot of our NHS partners and our local authority partners to deliver distinctive services that meet the needs of our local community, largely through volunteer involvement. And we also have opportunities for lots and lots of people that have been affected by cancer to share their experience with lots of other people. So what I'm here really to talk to you about today is about how we've integrated volunteers in the delivery of cancer services, both directly through our own Macmillan staff and indirectly through our partners, which are largely NHS partners and local authorities. To give you an idea of how we are pioneering, in some cases, distinctively new services, and how we're kind of managing and bridging the risks associated with involving volunteers, and to show you the range of examples. So, as I mentioned, Macmillan, we provide two kind of volunteer models. One is a direct model, which this is services that are set up to be delivered to people affected by cancer and their families, and provided by a paid Macmillan member of staff. These services include direct volunteer services, so these are services that are in our communities, and they provide practical and emotional support to people and their families out in the community. We also provide volunteers that provide support to people with financial challenges caused by cancer to make sure that people get the help and the support that they are entitled to. And we also run a whole range of physical exercise and activity programs for people who are experiencing cancer to sort of help improve their emotional health and their well-being as well. So we have a whole range of examples there. And we also have, as I said, services that are developed in partnership with our health and social care providers. This is a really big area that Macmillan funds. We fund an enormous amount of services that are delivered through our hospitals and in a whole range of aspects, and also into the communities. So examples of this might be that we have a whole range of information and support centres that are in hospitals. We have around 500 of those embedded within the hospital environment, and they all are managed by Macmillan staff and delivered through volunteers. We also have volunteers that are part of our assessment process, because all our information and support centres are what we call are embedded within a NHS environment. So we want to make sure that the environment is suitable and a quality environment for everybody who goes and visits that place. So we have lots of volunteers that are involved in the assessment and assurance of our environments, our cancer environments. We have also lots and lots of volunteers that help meet and greet people in hospitals and navigate them through the various departments within a hospital. These are what we call our navigators and our meter and greeters. We also have lots of volunteers that are help with assisting with wig fitting as well. So we've had lots of services there around that aspect. And we're also now providing volunteers are providing emotional and practical support within our palliative care services. So they are there to complement the work of paid professionals by providing them with the emotional and practical support that they might not necessarily have the time to give of the people affected by cancer. So we also have a number of services and volunteers working with palliative care as well. Right, so just to give you an example of a direct service, this is a service that is delivered through a Macmillan member of staff. So this picture here, this is Mary. Mary has finished her treatment successfully, but is struggling with day-to-day activities. Through our direct services, we can help Mary get back on her feet in a wide range of ways. Our direct volunteering services can provide Mary with practical and emotional support. We have fully trained volunteers that can help her with housework, shopping, gardening, travelling to and from appointments, or walking the dog. They can also provide a listening ear and signpost her to a wide range of other Macmillan services and other cancer services within that community as well. There are now over 80 individual direct volunteer schemes that we are now running with around 350 volunteers. And to date, they have helped over 2,000 people, provide them with practical and emotional support. These schemes are continuing to grow and develop, and we are seeing them not just meeting the needs of people, but we're also now looking at how we can transition younger people through cancer treatment back into work. So we're having a look around work mentoring skills and sharing and things like that. So we're constantly evolving our direct services based on the needs of local people. Mary can also access what we call our Team Up. This is quite an innovative service. We've been piloting it for 2 years, and it's an interesting one. We wanted to embrace internet, into IT, digital technology, and also in one way to diversify our range of volunteers. Now, traditionally, Macmillan, we always have retired older women. So we are kind of thinking, for us to inspire millions more to give their time, we need to sort of change the demographics of our volunteers. So one of the ideas was to develop a service called Team Up. This is a digital platform where somebody who is needing a little bit of extra support at home, but doesn't need the support, regular support of a volunteer, can just post on a digital site on their smartphones that they just need the bins put out on a Thursday. And then what we're trying to do is people, volunteers, see this and say, okay, this lady is in the street that I walk through to my way to work, I'll put her bin out on a Thursday. This is what we call micro-volunteering, and we're trying to tap into the demographics of volunteers that don't want to be regularly committed to volunteering, but just want to do a tiny little bit, maybe once or twice a week, or once a month, or once a year. So Team Up is a 2-year pilot. It's coming to the end, but we have decided that we are going to expand it and integrate it within our wider offer of volunteering services at Macmillan. And just to give you an idea about our indirect services. Now, this is a Macmillan Wellbeing clinic. This is a clinic that is in Bristol, and we are building more and more of these in partnership with our NHS partners. These clinics provide a wide range of services that are under one roof. They include things like complementary therapies, cancer information and support, wellbeing courses, art therapy, walking for health. These are kind of like central hubs within an NHS environment, which all are managed and delivered through our volunteers. As you can see, these are volunteers. They are technically all part of the same wellbeing centre, but they do a wide range of roles. They are managed by professional volunteer managers, and they are provided with excellent support, supervision, induction and training. We are developing more and more of these centres, and we are really pleased with the way that these ones are actually establishing, and we're working so much closely now with our partners within the NHS. One of the things that I've been listening to as part of the discussions is this thing around risk, about involving volunteers in the delivery of cancer services, and the fact that sometimes volunteers might not necessarily be a solution that we automatically think about. And that is the case at Macmillan as well. So one of the things that we've developed 2 years ago was the Macmillan Volunteering Quality Standards. Now, the standards are our benchmark of which we would expect all our volunteers to be managed by our own staff and our partners. It's one way of upskilling, I suppose, what we would say, medical staff. A lot of our cancer nurse specialists take on responsibility of managing volunteers. They might not have ever done that before. So one of the ways that we're trying to help develop the skills and capabilities of professionals that aren't used to managing volunteers is through something like the Volunteering Quality Standards. Standards are a way that we can ensure consistency across all of our services so that all of our volunteers receive a high quality volunteering experience, and that everybody who is delivering or supporting that volunteer knows exactly what they need to do and how they need to do it. They have access to a wide range of learning and development opportunities. They have coaching. They can access wide ranges of resources and support. So we're really now trying to upskill all our staff and our partners within our NHS with the sort of understanding the value of volunteers and ensuring that they have the skills and capabilities to take on that role. So that's it.
Majestad, Ministro.
Her Majesty, the Minister, everyone, I'd like to thank the Spanish Association Against Cancer for the opportunity they gave us to present the Extremadura scheme, and particularly the regional government of Badajoz, who thought about me to deliver this presentation, and I'm very proud to answer the first question. Yes, it is possible. Health administration and healthcare can actually integrate voluntary work. And before starting my presentation, I'd like to give you some brief information about our region. Extremadura has around 1 million inhabitants altogether. It has a great geographical dispersion. We have a large number of rural areas and villages. From the administrative point of view, we have 8 different areas, each of them having their own hospital. And 60% of the deaths are due to progressive advanced health conditions with a great deal of suffering, and out of these about 1,500 are actually due to cancer. This is the reason why the Badajoz Health Administration saw the need to start a new palliative care scheme in order to provide care to these patients, whether they were in hospitals or not, and they also envisaged the creation of specific teams made up by professionals with high training in order to attend to these most complex cases at the end of the life of the people. Within this framework program, we actually saw the possibility of working with NGOs in order to provide complementary care to that care that was provided by the Extremadura Health Service. Volunteers have very important values in them, such as commitment, solidarity, gratuity, and as one of the volunteers said, I am a volunteer for a number of years, and I am very thankful that I can do these wonderful activities and such gratifying activities, because they help me live my life in a more intense manner. With each and every one of the people that I accompany, I give my all to make a difference in their daily lives. From that time, I tried to be a care, a word, or a smile, not forgetting the services that actually include everything, but palliative care should go beyond. They require good planning, and this is how we started, this is how we saw the need. Back in 2006, we had 8 different entities together with the Extremadura Health Service, and thanks to Dr. Rocafort, we started the palliative care voluntary scheme in order to cover all the needs of the patients and their families. As I said, we had 8 different entities in the early days. Currently, we have 15 such entities, and at some point they actually saw the need to reinforce their own identity as a network, and that's how they actually decided to be called the Voluntary Network of Palliative Care of Extremadura, in order to make their work, the coordinated and joint work, more visible, and to work better with the patients and their families. How do we come about with this specialized care? How do we work day to day? We sign a cooperation agreement with the Extremadura Health Service, which includes the figure of the coordinator for the volunteer plan, as well as signing the protocol of action between the Health and Social Policies Office and the 15 entities or associations that make up the network. We also set up a follow-up commission. They meet every 3 months, and they follow up the processes. As Maria Eugenia said earlier, we have a great many different associations, health groups, and so that's why we decided to draft a document with the different requirements for these organizations if they are to belong to these networks. So they actually put on the table different conditions for being part of the network. We actually clarify the distribution of responsibilities, the different mechanisms, and after some time we actually saw that there were new needs and demands from our patients, and that's how they decided to start the strategic plan for volunteer palliative care in Extremadura. And they actually identified different lines of action in order to make progress in the coordination between the public administration and the different associations. We actually included in among the priorities actually raising awareness of the voluntary plan, involving citizens more in voluntary work, and facilitating the incorporation of new entities and associations to the network, and also improving coordination between the entities themselves and the other organizations that depend or work alongside them. Apart from the different vision and mission and values, they actually set out different strategic lines with a series of indicators and specific actions. The strategic lines that were set out were to strengthen the network in order to have a basic structure that can ensure a number of yearly actions in order to improve and to further coordinate the palliative care. There is also an area of for raising awareness with the society, an area for the research and reflection on voluntary activities in order to improve such activities, and a coordination area with the actual regional scheme for palliative care, and involving the different professional teams and the palliative care teams. As far as the voluntary management area goes, the selection of the people who want to be volunteers is actually done by the organizations and associations themselves, but following certain unified criteria. There is a first interview by the coordinator of palliative care at the specific association, and then the future volunteer has to undergo a second interview with the person in charge of palliative care or the palliative care unit in order to inform them about the situations they might have to face, the high level of suffering that they will have to put up with sometimes, and to gauge whether they can actually put up with that level of grief. And they also are given training on basic palliative care areas related to diagnoses, prognosis, and also about enhancing their communication skills, and they are also given training on accompanying the family members after the death of the patient. This is all in order to try to improve the sense, the feeling of belonging to a larger organization. We actually have a network of volunteers up and running, and any professional from the healthcare system that detects a need for a patient to be accompanied will contact the coordinator of for the volunteers, which in turn will contact the nearby associations, those associations that are close to the patient, and they select the volunteer based on the needs of the patient. Then one or two people will be selected in order to accompany that patient for a number of hours per week, and finally the voluntary worker will contact the family members of the patient in order to arrange the start of the service and the exchange of information about those aspects that can facilitate the actions of the volunteer. Well, the different works we have done, and specifically for the end of life of the patient, voluntary workers will need to identify the needs of the patient and their families, accompanying not only physically but also emotionally, participating in the different distractive activities, and all the while having keeping a record of all the activities that they perform. And after 10 years working together with this plan, we have done around 1,800 voluntary activities in 114 towns in our community, in our region. We have more than 300 fully trained volunteers, and we have provided care to more than 500 patients already. I must say that it is always easier to find volunteers and to provide the activities in more urban areas than in more rural areas, but we do have great coverage at this point in time. Just to conclude, I'd like to say that this voluntary scheme has broadened the care and attention to the patients themselves and their families, and it has actually complemented the works from the professionals attending to the patients and their families at the end of their life. They actually improve the cooperation and coordination with public entities. It actually increases participation from the community, and it improves the care for the patients at the end of their life. I would like to finish with this sentence, with this quote that actually summarizes the work that we do, both the professionals and the volunteers. Cicely Sanders once said, "You are important because you are you, and you will be important until the end of your life. We will not only help you die in peace, but we will help you live until you die." Thank you.
Buenos días a todos.
Good morning, everyone. Thank you for being here with us today on this International Forum Against Cancer. It is a great pleasure to represent the Spanish Association Against Cancer, because I do not only represent coordinators but also the volunteers themselves. So I do hope that my experience from the Cepeda Ochoa Hospital in Madrid might be of interest to you.
Hay cuatro aspectos claves que son importantes.
There are 4 key aspects that are important when it comes to integrating any voluntary team at a hospital. The cooperation agreements, the relationship of cooperation and collaboration.
Salido en otras ponencias es la importancia de una buena selección y una formación integral y continuada del equipo de voluntarios.
Why do we have these agreements in place? Well, these provide the basis for the cooperation with any hospital, because they allow us to make that relationship a cooperation in a more formal way, and they actually facilitate and allow the cooperation between the Spanish Association Against Cancer and the different hospitals. These
Y ver qué es lo que
they allow us to see what we are doing, and if what we are doing is actually correct, or whether we should implement any improvements. They also allow us to attend to the needs of the patients, because these needs actually do change over the years, and the needs today have nothing to do with those they had 60 or 63 years ago when the Spanish Association Against Cancer first began. If I may, I would like to read the last sentence. And that's over 60 years ago. Over 60 years ago, thousands of people have supported our activities, and together we have created the Spanish Association Against Cancer as we know it today. The second important basic point for good integration of the volunteers is the professional quality or professional training of the coordinators. They need to have knowledge and update their knowledge. As I said earlier, the needs of the patients are evolving and ever-changing, and our services and our knowledge should also be evolving and ever-changing. Apart from this professionalization of the coordinators, let's not forget that coordinators or volunteers of the Spanish Association Against Cancer are part of different committees, different clinical sessions in different oncological areas. So this relationship, this training will help us when we have communication and when we meet with the psychologists, with the doctors, with the oncologists, and so on and so forth. And this also allows us to convey the right information for the volunteers, the information that they need to do their everyday work. It also will allow us to respect Data Protection Act, which is so important for the patients. Coordinators are not only the bridge between the hospital, the patient and the volunteer, but we are also the spokesperson at the hospitals. We have to have a good relationship between the objectives and the realities. And lastly, but not least importantly, we need to favor something that you mentioned before, the importance of continuing training of the volunteers, motivation of the volunteer teams, and also good follow-up of their activities, their daily activities. The relationship of cooperation between the Spanish Association Against Cancer and the hospital is paramount. It would make no sense to be in a hospital that is not committed in the fight against cancer. And similarly, it would not make sense to work with any hospital if we are not willing to work with them every day. We must know the potentials of the activities of the hospitals, and we also know the needs of the patients. And when I talk about patients, I refer to both the patients themselves and their families. Let's not forget about the families. The coordinator will try to adjust the needs of the patients to the actual skills and capabilities of the volunteers. So not all families and patients will require the same set of skills in a volunteer. And finally, another key aspect would be the selection and integrated or comprehensive training of volunteers. We need to have a very good previous selection with very well structured interviews, so that we can adapt the profiles of the volunteers to be, if you like, to the requirements and the needs of the hospitals and also of the patients. And this is something that someone also said earlier. We need to know what cancer is all about. They also need to know about risk factors and prevention activities. They must know about the preventive campaigns that are launched by the hospitals. They will also have access to much more in-depth knowledge of the Spanish Association Against Cancer, our objectives, our functions, the organigram of our association, our ethics code, and so on and so forth. And also we need to show them that there are different alternatives within the Spanish Association Against Cancer. You not only have direct contact, there are many other things you can do and that actually ultimately help patients and their families. Maria Jose, I loved listening to your presentation because I think we do have the same criteria. We share many criteria, although we belong to different entities when it comes to the coordination, and we also provide the necessary capacities to the volunteers, because at the end of the day they actually represent us before the patients. We must give them the necessary set of skills to work with the patients on a daily basis. We must give them the guidelines that they need to to manage that interaction with the patients and their families. And let me just say once again that it is important to supervise, to follow up, and to motivate our volunteers for the excellent work they do in hospitals every day. I hope I have answered your question. How do we integrate the voluntary teams? This is my experience, and again I hope that I will be able to answer your question. First of all, we need to have a space, the necessary space and resources to coordinate our activities. The hospital needs to know where we are, what our telephone number is, what our working times are, etc. And we will also need to present before each of the services of the hospital our program of action. We do not apply the same protocol, the same coordination activities for each and every one of the areas of the hospital. And why do we need to adapt our protocols and our work and the work we do? Because we want to offer comprehensive care that is adapted to the needs of the patients and their families. And comprehensive integration starts from the onset, from the time that someone is told you have cancer and they feel totally blocked and lost. But we need to go with them from the very onset till the end. In the early stages, maybe the patient, what they need is a much more instrumental company. They need to have someone to come with them to set up their appointments. But at the end of their lives, the patient, or very often the families, what they need is to have someone in a much more emotional level. Someone to ask you how you're feeling, if they can help you with anything. We will value constantly the work we do. This is why we have our clinical sessions, in order to assess the work of our volunteers, and if there are certain areas for improvement, we will improve, and if there are certain new things we can do, we will take them on and start doing those things. But we also have to base our actions on the commitment towards patients. And how do volunteers do this? What activities they actually do in order to be fully committed with the patients, with intra-hospital accompaniments, and by picking up the patient and take them to hospital, to different consultations, chemotherapy sessions, and go back home with them again. This is a way of integrating. Free breakfast at the day hospital. Our volunteers are not waiting staff, but rather what they are doing is a citizen, a solidarity action. Free breakfast, what it means is that they can get closer to the patient on the first day, break the ice, as we say, explain what the volunteers do at the hospital, and just simply being with them at that first contact with the chemotherapy sessions, with the hospital, and help them feel more positive. But we go beyond, because we also have activities for the families. We have different activities, dancing, aesthetic care, general care, personal care. We have many workshops about these and many other issues, and participation in psycho-educative schemes. We work with different tobacco schemes in different areas, and in order to have a good integration, we need to plan our activities with the actual hospital staff, be it leisure activities or training activities. And finally, since we are actually at the hospital, if the hospital requires our help, we must be active also with them. This is the work commitment that I told you about earlier. And if I may, all of this, I would like to summarize it, as some might say, it is not the same thing to say something as to live it. And just let me show you these pictures of what we live every day. Thank you very much.
Ven conmigo. ¿Nos vamos? Se va conmigo.
Come with me, please. Thank you for sharing your experiences. We have been talking about volunteers, and we haven't heard from them yet. Victoria Sancho and Miguel Ángel Alonso de Goya are two volunteers who represent... No, I'm not. I'm actually the wife of a patient. Well, in any case, they represent patients, volunteers. They will give you the other side of the story, and I will now give them the floor to share their experiences. Who will start? Yes, good morning. I believe that each and every one of us at some point in our lives have thought, now that I have some time, and I might devote that time to someone else, why not do it? This is the reason why I actually decided to become a volunteer. And after thinking about different options, I actually chose the Spanish Association Against Cancer, and the idea was very clear. Her Majesty the Queen, in her speech, when she said it is not only about wanting to be a volunteer, she is quite right. It is much more than that. And here we must learn on a daily basis, and the Spanish Association Against Cancer, through that training, has helped us, or has helped me, for one, as a volunteer, to face very difficult situations indeed. Paloma just mentioned it now. The training we have, and we receive theoretical training. We have a great many hours. We also have a testing time at the hospital, a trial stage where the veteran volunteers are actually helping us, and they are teaching us new things in order to help those patients and their families. Not so long ago, someone sent a Twitter message, and someone actually said in that tweet that they did not want to cry with their family. And this is where we volunteers come into play. There are some people who do not want to talk to their families about their problems. They are scared, they are too worried, and this is what we are here for. We are people who have the necessary capacities, the necessary skills and training, and who know the limits. We have also been given that training from the coordinators. We do not just do anything, we know how far we can get with the patients and their families. This is very clear. And to get back to my story, I had a case that happened to me, a very young person who had just become a dad, and he was very scared, and he actually refused to speak to his family, to his wife, to his parents. He would not talk to him, and I, through a series of empathy mechanisms, I actually got them to talk to me, and he actually expressed his fears to me, and the only thing I did was listen. That's all I did. I looked into his eyes and I listened to what he had to tell me. He was much more at ease after this, and when I left the room I just did this to him, and he said thank you. And there was no need to say thank you, because he actually made me grow as a person, as I keep on growing every day, and I must thank the Spanish Association Against Cancer for this. I was able to have sympathy with the patients and their families through just using a magazine, a newspaper, or a bottle of water. Because the previous sessions, prior to the chemo sessions, there are many fears, uncertainties, patients and their families that come in different ways. and in different states. And just by sending them a smile, I remember that since I am so tall, I actually hit the one of the elements on the floor in the hospital, and I remember everybody was laughing then. And I can tell you, I would bang my head every single day if I managed to elicit that smile. Because at that time, with this accident I had, I actually broke routine. And this, as a volunteer, is the most you can do. I don't even have words to express. I do not want to forget that this is all teamwork, where we have our coordinators, the people who provide the training, and my fellow volunteers. I keep on hearing that we are very good people, very humble, and I must say that we are just normal, average, ordinary people. And that if one day I am in that position, I would also like to be helped. As far as what Lisa said, I do not think that volunteer is only necessary at a hospital, is paramount, is key. I have no question about that, and I can tell you this based on my own personal experience. So I just want to thank the Spanish Association Against Cancer, because being a volunteer was, is, and will remain to be the very best thing that happened to me in my life. Thank you. Good morning. I am the other side of the story of this heart disease. I am the wife of a patient of cancer who has faced his illness with great dignity and with great values. My first contact with volunteering was anecdotal and very surprising. It happened on the day my husband was operated. A day where, for obvious reason, I was really depressed, I was really scared, and my family would force me to eat. I refused to eat at that time, but I actually listened to them finally and came down for lunch. When I came down, in the foyer of the hospital, there was a table from the Spanish Association Against Cancer who were raising money, and one of the volunteers approached me. She asked me, "What's wrong with you?" And with a great deal of affection and with a great deal of comprehension, she kept quiet. She just hugged me, and that was enough to make me stronger and to carry on. Later on, and throughout the different stays in the hospital, it was when I actually perceived the great work that all voluntary do, who the first time who came to our room with a great deal of respect and with a great deal of love and comprehension, they offered us their company. These people actually were new air in our lives. First of all, for my husband, but also for myself. Thanks to their conversation, their sense of humor, they would break the daily routine at the hospital. He was distracted. He would talk to them. We could actually laugh from the different stories that both parties shared, and I was happy and satisfied just by looking at him being so happy and cheerful. But also when my husband was just sleeping or was not in the mood to talk to them, they would also be understanding. They would just leave the room, they'd take me out with them, and they would just have a little conversation with me or just held my hand. Therefore, the greatest pride that I could have was to become a volunteer myself. So to them and to all of you fighting this hard disease, I must thank you all. Thank you.
Gracias a Victoria.
I'd like to thank Victoria and Miguel, and we will now close this event with the conclusions. Yes? Yes, of course. You may go ahead. Would you like to come on stage?
Yo estoy muy impresionado con todas las ponencias, han sido espectaculares. La profesora, el doctor García Millén, doctor Oliveras y las tres ponentes, ¿no?
Amazing presentations. And what I see here is that there is a common factor, and it's the need of forming volunteers, training volunteers. We need to have well-prepared volunteers, properly trained. And out of my personal experience, we have a lot of volunteers that are not sure of what they need to do or what they have to do at this moment. And as a member of a foundation specialized in palliative care, we need to know that there is not the same thing to provide this kind of care to a Muslim than to an agnostic, for example. And another experience in Telefonica is that volunteers are people that you can learn a great deal of. These functions like this. And at this digital world where we live in today, it would be convenient to collect all the experiences of the volunteers in order to provide, through the digital technologies, training about, for example, psychological issues related to the disease. For example, provided to the medicine faculty at the university, and to show them the way they need to face different challenges. And this is easy to do. And from the Telefonica Society, I'm opening the doors and the possibilities to do this. I've been informed that we have time to have a round of questions and answers. Specialists, please, you have your microphones open. If you want to participate or you want to ask questions, it's the moment now. Hello. My name is Manuela Monleon. I'm a nurse in palliative care, and I wanted to ask Maria Jose Redondo. First of all, I want to congratulate you, because I would like to have something like what you have in your hospital in Madrid, and I don't know why. We cannot have it here if we function as a country. But I would like to know which is the percentage of care that you provide at your hospital, because I think as a palliative assistant professional that this is abandoned. The patient is abandoned, and by the end of the final stages of the disease, as it advances, as it progresses, the patient is more and more abandoned. So why? Is it a cultural issue? Is it that the family, that the relatives want to apart the patient, hide him or her? Yes, the model that we started using in 2002, this first problem that you were talking about, that there is no equity in palliative care, since we need to work with practitioners, nurses, psychologists, etc., is a multidisciplinary team that goes either to the hospitals, to the houses, etc., and that we form a homogeneous network of healthcare for the patient and the relative. It enables a lot the possibility to be there where the patient really needs it. And the percentage of activities either at home or at the hospital is more or less developed from the point of view, as I said before, multidisciplinary. I would say that is not 50%, I would say around 60%. So it's quite homogeneous. As I was saying before, the voluntary is able to travel, to go wherever we need, so there is no problem about that. And lastly, I would like to tackle the fact that it depends, of course, on the personal situation. And this initiative provided us with ears. We were able to sit with the volunteers, the relatives, and develop and design as a plan with all the actors being part of the team. It depends a lot on the population settlement. If we are dealing with a big city, it's true and obvious that voluntary figure is less recognizable. It's not the same to work in a small town, for example, and there are, and it is important to capture entities in the area and raise understanding among the population. And this line, this strategic line of volunteerism is to make it become more homogeneous. Is it easy to be inserted in a house support care? Because they are all the time at the hospital. It depends on the voluntary network and together with the system, with the health system. It is true that we provide this action when it is asked, but we need to define if through the contact with the first voluntary, when the voluntary arrives, it is he or she is instructed about the likes and dislikes of the patients, etc. And this enables a better work. Yes, good morning. Another year sharing with you in this forum of the Spanish Association Against Cancer. I would like to emphasize and congratulate the role of all voluntary workers. As a wife of a fighter against cancer, it's true for me that without the work of voluntaries, it would be impossible. Voluntary workers provide, in many cases, this lack of humanization that is true in many centers or care centers due to the rush where we don't have personalized attention, personalized care provided. So I want to express my acknowledgement. I want to congratulate the Spanish Association Against Cancer because the work they are doing is vital for us. Thank you very much. Thank you very much. Good morning. I'm a doctor. My name is Fernando. I belong to the community. Fortunately, we are all represented here. We are small when it comes to numbers, but we are large as extension. Thank you very much, Maria Jose, for your mention before. But I wanted to thank the association. I am a voluntary worker, and I'm proud to be a voluntary worker. But voluntary work is here to stay. It is important. The Spanish Association Against Cancer in the 50s was the first in Spain, and we inherited this task. But later we had this screening campaign against uterus cancer. Later on we developed palliative care. We developed psychological support, and at the end, if there is an association that's been doing I+D, is our association, because we have invested and developed so many new areas, because we understand that we need to be present. So I am proud of it. But I really liked what Doña Victoria said, because she's part of it, and she has witnessed that we have a fresh air coming into the system. Thank you very much. I don't know if we have a microphone over there. Yes, good morning. Luciano from the Platform of Voluntary Workers of Spain. First of all, I would like to congratulate the Spanish Association Against Cancer for this amazing informative day. I would like to ask a question, and later I'm going to emphasize on the law. First, my question: how do you train patients, cancer patients, do you do it on a different way? How do you manage the system in general? Why is this question? Because I work with drugs, and we need to really provide specialized training to those who are going to be working as volunteers. And then I have another remark to be done that will sum up what is being doing here right up. The role of all the actors here. And I want to emphasize this. I want to talk about this law that sums all the roles that are meant to be done by the different actors. This is the last question that is going to be asked, because we won't have more time. As for the voluntary training, you were talking about the patient and the ex-patient. Initially, a patient cannot be voluntary in our association because we have two main reasons. Therapeutically, it's not a good idea, and emotionally, it is not. Until it's been a year after the end of the treatment, it is not possible. There is time for healing and there is time for volunteering. And then for the rest, we need to view it from the point of view of your personal experience. Since the voluntary worker is not going to tell his personal experience, he's going to be there to listen, to help, to provide support and care. We need to emphasize communication skills and, of course, mainly active listening. I don't know if I answered your questions. I'm sorry, but I know there are lots of questions remaining, but our time is getting up. I want to give my personal point of view. I am the proud daughter of a cancer fighter, my daughter, and also a sister of a professional working in palliative care. We are a very close family, and we've been going through a lot of loneliness. And of course, this dark path that we've been going through is received, of course, the influence of the Spanish Association Against Cancer. I would like once again to congratulate and to thank this association for all what they are doing. Thank you very much. Thank you very much, Mamen. Thank you, all of you, Your Majesty, Minister, State Secretary, all of you, to all of have made possible for us to be here today and to tackle this important element. I am proud to be a voluntary myself. I have the immense privilege to live as a voluntary. That's why it is so touching for me. This 5th edition of this Forum Against Cancer, focused on volunteering, has been the opportunity to remark that cancer has a social impact, an increasing social impact, not only social, liberal, economical, but we need to acknowledge that we are living each time longer. The life expectancy is longer. Each time we survive in better conditions to cancer. Family models are changing. Social, economical models are changing, and we have a higher risk of isolation and loneliness. In Spain, we have around 30,000 cases of patients of cancer of more than 65 years old living alone. And the expectations are that these figures are going to grow even more. These patients living in loneliness will have to resort to some kind of help. volunteerism becomes one of the sources of help and support that the society could provide. We talk a lot about this. We are quite informed about the added values of volunteerism. The Spanish Association Against Cancer, we are more than 20,000 volunteers carrying out different activities, accompanying patients and relatives of patients. We're talking about around 60,000 volunteers properly trained and receiving the support of more than 170 health professionals that are carrying out this fundamental, vital task of training. Volunteerism provides also a high-quality care for the patient and the family. Why? Because this complements the care provided by professionals. The tasks that they carry out are quite different, and it generates a mutual benefit, as was explained in a brilliant way by the first speaker. The sanitary personnel or the healthcare personnel is also benefited. But in order to receive all these benefits, we need to integrate the voluntary work and the national health system. It cannot be considered as a plus. It needs to be a fundamental element integrated in the system. And which are the conditions for this to be achieved? But of course, support the commitment of the actors that are meant to introduce this to the system. We couldn't be better represented. We are talking about the services heads. We have all the actors included and committed. We have another factor talking about not only about the patients, but the system, the care team. And we have another goal, that is to take the voluntary work to the place where it is needed, either at the hospital, at the houses, communities, daycare centers, as was shared by our speaker from the United Kingdom. In order to progress in this, we ask to the actors a series of commitments, a number of commitments, to incorporate to the task quality training and indicators of a comprehensive care, establishing plans or programs for this support volunteering to the cancer patients and their families, together with entities or NGOs, as we had the example from the UK. Number 3, assessing systematically the activity of voluntary workers and the impact on the life of patients and families, to do it in a proper way. At the same time, we commit as a Spanish Association Against Cancer to increase the number of staff and to establish quality standards, including training, follow-up of the service. So we've been talking about quality, but as we were saying before, I want to tackle the necessary humanization in vulnerable environments as the disease environment. We don't want to have a single patient that would feel alone, not properly informed, or not receiving the proper care. The proper work of the volunteerism will contribute to it, and is an indicator of a committed society generating hope for a better future for all. That is true. Hence, we need to promote it. We need to value this. Thank you very much. Thank you, President, Chair. So we are coming to an end of this 5th Forum Against Cancer. Thank you very much for attending these talks, and we invite you to share with us and continue with the dialogue in the coffee break that we've organized.